Hey everybody, and welcome back to my PTCB online study resource. My name is The Farmer Life, and today is part 3, drug interactions. So what exactly is a drug interaction? A drug interaction occurs when a drug reacts with another substance, whether that be another drug, a food or drink, or potentially a medical condition that causes the drug to not perform as we would expect it to. So what makes drug interactions bad? Basically, the absorption of the drug, the enzymes that are working to absorb the drug distribution throughout the body, as well as the elimination of the drug can all be altered. So we'll be discussing 3 main types of drug interactions. We'll be talking about drug-drug interactions, drug-food or beverage interactions, and drug medical condition interactions. In each of the slides, I'll be referring to what each means, as well as the most common that we'll see in a pharmacy setting. So we'll begin with drug-drug interactions. This occurs when a drug's effect is altered due to a separate taken drug. The combination of the 2 drugs can cause adverse effects on the body, and it can cause a increase activity of one or both of the medications. Alright, so we'll begin with fluoxetine and phenelzine. This can cause serotonin syndrome. Digoxin and quinidine can cause increase in plasma concentration levels of the digoxin. Sildenafil mixed with isosorbide mononitrate can cause increased hypotensive effects from isosorbide. Potassium chloride mixed with spironolactone can cause hyperkalemia. And clonidine mixed with propranolol can cause hypertension. Alright, next we've got warfarin with diflunisal, which can cause GI tract bleeding. Theophylline with ciprofloxacin can cause toxic increases of the theophylline. Pimozide with ketoconazole can cause ventricular arrhythmias. Methotrexate with probenecid can cause toxic increases of the methotrexate, and bromocriptine mixed with pseudoephedrine can cause ventricular tachycardia, peripheral vasoconstriction, seizures, and death. Next, we'll be discussing drug-food interactions. This can also include beverages, and can cause altered effects of the drug due to a food or beverage that is consumed. Combinations of the drugs with certain foods or drinks can result in adverse side effects, and these can cause increased activity of the drug taken. Common drug-food interactions we might see: antibiotics mixed with calcium-rich foods. The calcium binds to the antibiotic, creating an insoluble substance that cannot be absorbed. Warfarin mixed with vitamin K-rich foods. The vitamin K is vital for producing clotting factors, which prevents the anticoagulants from working. Stimulants mixed with alcohol can cause excessive intoxication. Statins mixed with grapefruit. This can either be the food itself or juice. There is a chemical in there called furanocoumarins, which increases levels of statin in the blood. Monoamine oxidase inhibitors mixed with tyramine, which is an amino acid, can cause a dangerous increase in blood pressure. Finally, we will discuss drug condition interactions, and this occurs when a medical condition is present and certain medications may show adverse effects. So common ones we'll see in a pharmacy setting are going to be decongestants with CVD, cardiovascular disease. Decongestants work by shrinking blood vessels, which can raise blood pressure. NSAIDs with cardiovascular disease. NSAIDs cause fluid retention. Nephrotoxic drugs with chronic kidney disease. This can be extended to a numerous list of drugs, but with chronic kidney disease, the kidney's ability to function is highly decreased. So when the drug is being excreted through the kidney, sometimes it can stay in there for more than it should be, so it builds up and builds up and builds up, and it causes a toxic level of that drug. NSAIDs with digestive system disease. NSAIDs wear away at digestive lining and also can increase the acidity levels in the stomach itself. And finally, beta blockers with asthma, as beta blockers constrict the blood vessels in the airway. So that's going to conclude today's video. If you guys did enjoy it, please leave a like and subscribe. I'll be trying to fire out these videos as much as I can. But I'm going to be trying to go through the whole entire course outline of the PTCB test and get that all put on YouTube for you guys, so you have a resource to come back to listen, watch, and study from. Alright, thank you guys so much and have a great day.